The popliteal sciatic nerve block provides anesthesia that covers the majority of the lower leg, ankle, and foot. There are small areas of the medial tibial plateau, medial lower leg, and medial malleolus that are spared by this block. However, this block can be a useful tool in a wide variety of lower leg pathologic conditions in the emergency department. As an example, a complex fracture involving the ankle, like the bimalleolar fracture seen here, that requires reduction and splinting in a patient that may be high risk for procedural sedation, may be a great opportunity to utilize the popliteal sciatic nerve block. Another example would be a deep and complex laceration such as this to the posterior calf that requires irrigation and repair. The best positioning to perform this nerve block is for the patient to be prone. You can place the probe in the popliteal fossa in the transverse orientation as shown here. This is similar to the positioning that you would do for an ultrasound evaluation for DVT. A good landmark to identify initially is the popliteal artery, which is the deepest vessel. The popliteal vein should be superficial to this. Superficial to these vascular structures, you may see the tibial nerve. If you trace this nerve cranially, you may identify the branch point of the common peroneal nerve. This branch point is the optimal location to perform the block. Just proximal to the popliteal fossa in the posterior leg, you can identify all the landmarks that are needed to perform this block. The deepest structure that you may see is the hyperechoic border of the distal shaft of the femur. Superficial to this, you will see the popliteal artery. Superficial to this, the popliteal vein outlined in blue here. Superficial to that, you will see the tibial nerve outlined in yellow here. Lateral to that, you will likely see the branch of the common peroneal nerve. If you trace these nerves proximally, you may see when they come together, forming the sciatic nerve. The location that the nerve block is performed is just distal to the bifurcation of the sciatic nerve into the tibial and the common peroneal nerves. In this ultrasound clip, we see the landmarks being identified. This hyperechoic line here is the distal femur. And you can see the pulsating popliteal artery here and the vein sitting just on top. The tibial nerve can be seen here, and coming in and out of view here is the common peroneal nerve. Once you have identified all those key landmarks, you can set up to perform the nerve block procedure. The preferred approach to this block is the in-plane technique. The needle enters the skin just lateral to the probe and is advanced from the lateral to medial orientation towards the target under real-time ultrasound guidance. The ideal location to inject anesthetic is just distal to the bifurcation of the sciatic nerve, where the common peroneal nerve and the tibial nerve are separate structures, but are close enough together to block with a single injection. The needle tip is advanced from the lateral aspect as shown here. The needle is followed in a long axis. The needle tip is placed in the space between the tibial nerve and the common peroneal nerve. Injection of anechoic anesthetic fluid should fill around both nerves to achieve a good block. 15 to 20 cc's of anesthetic is required to achieve a good block. Thank you very much for your attention and for your interest in performing nerve block procedures that can greatly benefit our patients.